This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel. Women play various roles either in their career or at home. Despite all the roles they carry out, the true test of a woman happens inside their body. Every woman goes through a menstrual cycle every month. Menstruation starts at puberty, and it can last until a woman reaches her menopausal stage, which is between the ages of 45 to 55. Most women breeze through their cycle. And then there are those like Grace. 25-year-old Grace Obanya, a spa manager, suffers from dysmenorrhea. Dysmenorrhea is a gynecological condition in which a woman experiences a range from mild to extreme pain during her menstrual cycle.
Naramdaman ko nga siya during the first day of my menstruation. Naramdaman ko na kaagad yung nalalamig yung paa ko, cold feet, and until sa leg area. And then pati hands ko, malamig ang puson, and malamig siya, pati cold sweats.
Recent study shows that 50% of women experience dysmenorrhea more frequently between the age of 15 and 25. Dysmenorrhea can debilitate and prevent a woman from doing her daily activities. Grace's dysmenorrhea is a nightmare she has to deal with every single month.
Talagang nag-faint na ako, papunta naman ng work. This is sa MRT. Yan. Parang naramdaman ko na lang, nalalamig na nga yung mga, I have cold feet na, yung mga kamay ko, tsaka yung puson ko. And then, yung parang nagba-black out. Siguro dahil sa pain na lang din.
What causes dysmenorrhea? Is this a sign of an underlying medical disorder? Are painkillers the only remedy to this condition? This and other uterine conditions tonight on MedTalk. March is Women's Month. And as we pay tribute to all the women out there, we will talk about medical concerns of women in all our episodes this month. Tonight, we will discuss uterine conditions. Joining us is Dr. Santiago Del Rosario, former president of the Philippine Medical Association and gynecologist from the Makati Medical Center. We also have with us Dr. May Sikiang, gynecologist from St. Luke's Medical Center and the Makati Medical Center. You can participate in the discussion by calling our hotline. You can also follow us on Twitter, post on our Facebook page, or send us an email. So let's start the discussion. Good evening, doctors. Welcome to the show. So we start off Women's Month by getting to know more about our monthly visitor, how our menstrual cycle affects us emotionally and physically, and how it affects those around us. So before we can go into an extensive discussion about that, let's first tackle how our menstrual cycle works. Dr. Santiago?
Menstrual cycle works under the influence of the hormones from the ovary. You see, in the first 2 weeks of the menstrual cycle, the first hormone, estrogen, builds up the lining of this. Can I?
Oh, yes, please.
You see, inside the uterus, the cavity is lined by a membrane. Now, after menstruation, it builds up by the estrogen from the ovary. More or less, after 2 weeks, the lining is well developed. So in 85% of women, ovulation takes place and the second hormone, progesterone, is produced and develops further the lining, making it ready just in case there will be a pregnancy it can survive by clinging on that lining. No? But 2 weeks after ovulation, if there is no pregnancy, the uterus gets disappointed. So it weeps by shedding blood. No? That is menstruation, which usually lasts from 3 to 5 days. No? Losing probably 4 to 5 cc per day, no? Average. No?
Average, that's about how many tablespoons, maybe, or teaspoons a day? 5 tablespoons a day?
About.
It's a very good description, no? When you say the uterus, it weeps,
Yeah,
thus
something
causing
like that.
menstruation. At least there's a more vivid description in our heads or in our minds.
Yeah, poets call it the weeping of a disappointed uterus.
Okay, and since we're talking about the weeping of a disappointed uterus, when one does start to have her menstrual period in puberty, at around what age does
It's about 9 to 12.
9 to 12? Is this
If it's
normal?
before 8
Unless,
years old, it's
this is
abnormal.
normally,
Yes.
unless it's a precocious.
Which is earlier.
Remember,
Which is abnormal,
sometime
yeah.
in South America, a woman got pregnant at 8
8 years old.
So she must have menstruated earlier than that. But that is abnormal.
Yes.
And normally 9 to 12 years of age
9 to 12. And
starts. First menstruation is menarche. No,
menarche.
menarche.
Okay, and since we're talking about normal, so what is the normal menstrual period? What are the signs and symptoms of a normal menstrual period? Dr. Sikiam?
When you start to have your menstrual cycle, sometimes it cannot be normal right away until around 19 years old. So it's not uncommon to have women who have regular menstruation starting 12 years old until 19 years old. But it's not normal to have your menstruation like every 6 months. Okay, so if that happens, you have to bring your daughter to a gynecologist. But once you reach 19 years old, more or less, the function of the brain, the signal to the ovaries from the brain, should be already regular. So you should have your regular cycle around 28 to 32 days. It doesn't have to be strictly 28 days or 30 days. No? Kasi when we ask women, is your menstruation regular? Ang unang sagot, doktora, ay,
What
it's
is regular?
Yes.
Oo.
It's not regular. Then when you ask further, what do you mean na hindi regular? It doesn't come on the same date. But when you look at the tracking of the menstrual period, it's regular. So it's between usually even 25 to 35 days.
Okay.
It doesn't have to be strictly every month,
On a
28
specific
days.
date.
Yes. Kasi the calendar itself is also more than sometimes 30 days, 31 days. February is 28 days.
28 days,
How do you
yes.
expect it to fall on the same date every month? So, but if your menstruation, when you're 19 and above, and your menstruation is like every 2 months, every 3 months, now that's definitely abnormal. So you have to see a doctor for further workup, okay? So that you should have a regular monthly period. And usually the flow, just like Dr. Santiago Del Sar said, is around 3 to 5 days, but it can last up to 7 days. And the flow should be moderate to heavy for around 2 days lang. Then the rest of the days should not be heavy parate. No? So if your menstruation is heavy for 7 to 10 days, then you should see a doctor just to be sure that nothing is wrong.
So prior to our menstruation, whether it be a normal or maybe on a heavy day, there are signs and symptoms.
Yes.
So what are the signs and symptoms of one who has her normal menstrual period?
Some women don't feel anything, actually.
Yes.
No, they go on with their work, or if they are sports people, they go on with their exercises. No?
Yes.
But some would have feeling of fullness in the breast, no? And also heaviness in the lower abdomen. No? Of course, some have also emotional problems.
swings.
You
Yes,
know.
Yeah.
mood swings, those are
They
the
get,
emotional manifestations.
They get short.
Actually,
Tempered,
I think aside from the hormonal changes that you're about to feel,
Yes.
no, from menstruation, it's the irritating feeling that you're bloated, no,
and
heavy,
Yeah.
So it kind of subconsciously get more irritated. Then suddenly you have these menstrual cramps. No, like me, I feel something before my menstruation comes. Some women, they have LBM,
Yes.
1 to 2 days before the menstruation. They have pain radiating to the legs, you know. So it really depends on the patient. Some patients, like doctor said, some patients won't feel anything because they're so
They're lucky.
active. And they're so
very
active,
lucky.
yeah, they're so active. Usually, if you see patients who are very athletic, they don't really feel so much of the menstrual cramps. Okay?
Some of them have headaches.
Yeah, I
or
used to have
migraines, no?
headaches and I
Yes.
used to feel cold. My
Yes,
hands
cold,
would be
clammy.
sweaty.
Oo.
Yes.
Yeah,
You know,
that's
I
right.
wouldn't be able to go to school.
It really varies from patient to patient. Okay, so unfortunately, some patients really have it very, very bad.
And we'll check if our Facebook question, if she has it really bad. This is from Claire Niwa. She asks, doctors, is it safe to use tampons or menstrual cups during my heavy flow? So we were talking about, we already discussed the normal, menstruation, the normal flow. Now, during our heavy flow, can you use tampons or menstrual cups?
Yeah. So,
Is it
what does he
recommended?
want to do?
If it's safe.
Doctor, to use tampons.
It's safe.
It is safe to use. That's why many women, particularly in the States, they use tampons, no? That used, but in the beginning they have the toxic shock
Yes,
syndrome,
yes.
but they found out it's due to contamination from bacteria. But when that problem was solved, then tampons became safe. No?
Safe already. How long should one have their
Yes.
tampons inside their system?
Well, I would advise the patient to change at least every 4 to 6 hours because the blood is there in the tampons. Okay, one of the cause of toxic shock syndrome is if you forget the tampons inside. Remember, the vagina can accommodate a baby.
Yes.
Okay, so sometimes they forgot to remove the tampons or the string got lost somehow. They thought they removed it, but they did not remove it. They put another tampons and they forget about it, and that's where infection sets in.
I had one patient
Yes, doc.
who forgot it for 1
Yes,
month.
yes.
Oh my God, 1 month? What happened to
And
her?
then she had delayed menstruation. She thought she was pregnant. So she came to my office, and it was not a pregnancy. Only there
It's
was
just
a
a tampon,
blockage of
yeah.
the
Menstrual
tampon, no?
So you should always remember what you put in has to come
Yes.
out.
Yeah. And you
not-
can imagine what kind of tampon it became.
Oh my. Oh no, well, doctor, will go back to that in a little while. Another question from Twitter coming from Annalisa Cruz. Is it safe to have sex during my period? Is there a chance I can get pregnant?
So it is safe. It is safe, you know. In the old days, the Jewish people, you know, when the woman doesn't want to get pregnant, they have relations during menstruation.
Okay.
And this was related by the Jewish people I work with when I was in training. No? So I even kidded the attending man.
Yes.
How come you are alive? I presume, no? I was jokingly
Yes.
presuming he had relations with the wife during menstruation. And the Jewish people, they kill the husband if the woman reports that they had relations during menstruation.
Oh.
That's why I was wondering why
Is it
there are still many Jews
Jews
around.
Maybe diba, we were saying earlier that it's emotional also. Maybe
Yes.
that's brought about why some women
By the
get
changes,
angry by the changes in their system, by the changes in all these hormones that are raging in their bodies.
But
We'll talk
that was
more about.
biblical, no?
Biblical.
That is true history.
So it is safe. Going back to the question. But doctors, we shall return to talk more about uterine conditions when MedTalk returns. We'll be right back.
Did you know that menstrual periods tend to be heavier and more painful and longer in the colder months? This is because cold weather causes muscle contractions and can cause cramps to worsen.
We're back here on MedTalk. Let's continue our discussion on uterine conditions. Dr. Sikiyang, the causes of heavy menstrual bleeding.
Okay. When you have heavy menstrual bleeding, like if usually you have 3 to 5 days of menstruation, then suddenly you have 7 days or more with clots, then you should see a doctor, okay? Common causes of heavy menstrual bleeding would be myoma, okay, endometrial polyp, adenomyosis. You can also have infection that can cause heavy menstrual flow. So if you have a heavy menstrual flow, do not forget to see a doctor. Especially if you feel dizzy already. Some patients would need blood transfusion because of heavy menstrual flow. Yes.
You mentioned myoma, polyps,
Yes.
and dysmenorrhea
Adenomyosis,
and endometriosis. Let's
Yes.
talk a little bit about myoma first. What causes myoma and what is myoma?
Myoma looks like this. This is the uterus. Okay, myoma looks like this. This type of myoma is called intramural myoma, this is in the muscles of the uterus. Some myoma is inside the lining. It's called submucous myoma, and in the serosal area, it's called serosal myoma. Okay, but the myoma that can cause profuse bleeding is submucous myoma, which is inside the lining of the uterus. And polyp is also inside the lining of the uterus. It can also cause heavy bleeding. Adenomyosis is where the tissue lining the uterus grows in the muscle of the uterus. So it causes contractions also, thereby causing heavy menstrual flow. So all of these symptoms, aside from heavy menstrual flow, you also have to see the size of the myoma or the problem and the signs and symptoms of the patient that will lead to the treatment of the patient.
What are the signs and symptoms of one that does
has
have
myoma?
this? Yes.
Well, aside from heavy menstrual flow, especially if the myoma is inside the lining of the uterus, you can have pelvic pain, pelvic pressure. You can have back pains also. You can have incontinence, infertility. Sometimes if the myoma is located near the opening of the fallopian tube. Okay, so those are some of the signs, but most commonly, the patient will feel pain if the myoma is very big already. Whereas the polyp, even if it's very small, since it's at the lining of the uterus talaga, you will really have profuse menstrual flow.
Okay, does this come out with your menstrual flow,
No,
or does it
no,
have
it does
you
not.
have to undergo surgery, or does it have
Well,
to be...
it depends where the myoma is. So if the myoma is in the muscle of the uterus or in serosal area, if it's not very big, if you don't have any signs and symptoms, then we can just monitor it. But even if it's very small, but if it's inside the lining of the uterus and you have this profuse bleeding every month, then it has to be addressed, usually surgically. So there are some medical treatments. The doctor will give you the options depending on your signs and symptoms, depending on the pain that you feel.
Does it also depend on the age?
Yes, also the age of the patient. So example, you have this severe pain, profuse bleeding, you're already in your 50s, you don't want to have a baby anymore. Then hysterectomy might be an option. But if you're just in your 20s,
Or in your teens?
yes, and you want to have a baby in the future, then it will be managed differently. Okay, so it depends on the age of the patient also.
And this is also brought about by hormonal imbalance? Is this hereditary? Is it a lifestyle thing?
The tendency is there is genetic predisposition. No? But hormones can also help produce myomas. No?
Okay. Once the myoma is taken out or the polyp is taken out, it doesn't grow back?
No more.
No more.
But others can grow.
It's good to know. Oh, okay.
Because whatever caused them, it's still there.
Even if it has
Yes.
been surgically
One
removed.
other cause of heavy bleeding
Yes,
no,
doctor.
is if you have hyperthyroidism. Or if a woman stops ovulating. After 30, many women will not ovulate every month. So in the months that they don't ovulate, the estrogen hormone keeps building the lining of the uterus heavier than normal or thicker than normal. So that when there is menstruation, naturally there is more tissue
Yes.
and bigger blood vessels are broken. So there is heavier bleeding.
So doctors, we shall answer a question from our Twitter account. Gloria Buenaventura asks, is it true that when you had your period at an early age, you will experience menopause early?
That is not quite true, no, because if a woman menstruates early, it means she has very normal ovaries. And barring any illness or other problems, that ovary will continue to live longer and function longer, so that actually she may have later menopause, no? Early puberty and later menopause, no?
Is there a way to compute for when one will be experiencing menopause depending on when she started her
No,
menstrual
it's
period?
purely physiological,
And
pertinent to the
roughly,
body.
you
of
can
the
also
woman.
ask your mom, more or less, kung kailan siya nag-menopause. Then, more or less,
So
you'll be
genetic
around
thing.
there, yes.
Oh, okay. Yes, doctor, you'd like to add something?
Oh, some menstruations are painful, no?
Yes.
And there is dysmenorrhea, no? Now, primary dysmenorrhea, when there is destruction of tissue, because in menstruation, the lining of the uterus disquamates, breaks into pieces, then come out with the bleeding, no?
Yes.
And in soft tissue, there is prostaglandin substance form, and this make the uterus contract, and the sensors in the muscle that is squeezed is interpreted as pain. No? But in other conditions, like mentioned by Doctora, when there is endometriosis, adenomyosis, even ovarian cyst, other conditions that are not within the uterus, they can also produce pain. No?
Okay. So it's really advisable that if it's maybe excruciating or severe or an abnormal pain
Yes,
that you
yes.
feel, it's best to go see your gynecologist right
yes.
away. And this one, since we're an on-air health consultation show, we received a question from Mariana Aragon. What are the other causes of delayed menstruation aside from pregnancy?
Oh, one of them is hypothyroidism.
Hypothyroid.
When there is deficient thyroxine, you know. The other hormones are affected, and there is delayed or even absent menstruation. No?
So is that
Amenorrhea.
amenorrhea? The absence of
Of course, we
menstruation.
don't refer to menopause. No?
We'll talk about menopause in a while.
Yeah, okay.
We have another question from Facebook. Alexis Chrysostoma asks, is there a recommended diet or food to avoid when we have menstruation, Dr. Askia?
Well, actually, wala naman, no? So, of course, we always advise the patient to have a balanced diet. But of course, it's usually
What
very
is the
difficult.
balanced
Yes,
diet, Doc?
exactly. So, avoid a lot of fats, fried food, junk food, soft drinks.
Sarap eh.
Yeah, I know, I know. But usually, what will help with the menstruation, with the flow and even the pain, would be yung lifestyle talaga, no? Avoid caffeine, alcohol, smoking, exercise more. Pero food per se, to give you parang exact food that you have to take to help you with your menstruation, I don't think there's such thing as that.
But prior to menstruation, women feel the urge
Bloat.
to have
To
salty,
binge.
sweet,
Yes, to binge.
spicy, to
Yeah.
binge, and then there's an emotional war
Yes,
that's
yes.
going on in our system.
Well, that's most partly because of the estrogen, the change in hormones, okay, before you have your menstruation. And as I mentioned earlier, you feel bloated, you feel, so somehow it's comfort food eh. No? So parang, I feel bad, I want to eat, and
Or-
I'm about to have my menstruation. It's,
Yes.
You're trying to justify it. no?
PMS.
Yes, PMS, but some women really do have very, very bad PMS. No?
Yes.
So, migraine, suddenly migraine. So, example, you were so busy, you didn't like calendar your menstruation, then you have migraine. More or less, if that's very normal for you, you might have your menstruation in 1 to 2 days.
You may also advise not taking coffee,
Yes.
because
No caffeine,
coffee
yes.
vasodilates,
Yes,
no?
yes.
And more bleeding can happen.
How about hygiene, Doctor?
Hygiene. Well, during
months.
menstruation,
Yes.
hygiene is very, very important. No? Unfortunately, a lot of the patients tend to kind of neglect. So, it would be best to have a good feminine wash. During menstruation, it would be best to use like betadine, okay, during menstruation. After menstruation, you can use your ordinary feminine wash where kung saan ka hiyang, okay? So during menstruation, it would be better betadine because betadine is kind of antiseptic. So it will help because blood is a good culture medium for bacteria. Okay, so we believe during menstruation, so betadine would be the best. And please wash dun sa how should I say this? Wash properly. Okay, hindi yung parang
What is the
wisik-wisik lang. Oo.
what is proper washing?
Okay, you have to kind of wash through the lips also, okay? So, but do not put your finger inside. Okay, some women kasi do that, no? So, do not do that because you will introduce infection. So, if you feel like there's something wrong with your discharge, do not examine yourself. Just see a gynecologist after your menstruation.
Okay. And is there any type of underwear material that one should use?
During menstruation.
Even
Cotton is
everyday.
better.
Yeah, cotton,
Yes.
underwear.
But with regards to feminine hygiene, when you introduce liquid in the birth canal, be sure there is a free flow, no? Because if you close the vagina, there will be increased pressure in the vagina, and the solution might enter the uterus, no? And since in bleeding, there is a wound inside the uterus, the substance can bring in to the uterus, and even if there are contaminations,
Yes, from the solution.
you
From
can
the
cause
solution.
infection. No?
Okay, before we move into, we're still talking about the menstrual cycle. Before we leave the topic, is there any particular color that one should watch out for? Is it supposed to be dark red? Is it supposed to be pinkish?
What is
What to
the
wear?
menstruation, doctor?
The color.
The
The color
color,
of the menstrual flow. The menstrual
the menstrual flow.
Yeah.
If it is fresh, it should be red, no? And it does not clot. But there are menstruations that do not come out early, so there is time to change for the blood into its degradation products, no? And it may turn dark green or brown. No?
Oh, okay. That's towards the end, no? The trickling.
Yes,
Dr.
yes, yung
Kia.
mga konting-konti.
So from a regular or heavy menstrual flow to the absence of the menstrual period, which is not even amenorrhea, because our discussion now moves into menopause. So what is menopause?
Oh, menopause. That is a period in the woman's life which signifies the end of her reproductive period. No? And the pictures, of course, are absence of menstruation for at least 12 months, no? Before you call it menopause. No?
What
And
happens to her ovaries? A brief
The-
description of the ovaries.
In menopause, the ovaries have shrunken, no? And they have stopped producing the normal hormones that they used to produce. No? So there are attendant symptoms and signs
Yes.
when that happens. No? The woman may have slight lightheadedness, headaches, there will be congestion of the breast, and later on there will be flattening of the breast, sagging, reduction of the size of the nipple, and all that.
Wow.
And then heaviness.
Heaviness. And then there's
And I think-
irritability and hot flushes.
Yes,
Other people
yes,
even experience being claustrophobic.
Oh, yeah.
Does it immediately end?
No.
Or
No.
does it end gradually with time?
The hot flashes,
the menopause,
Doc.
the menopause. Well, when you call it menopause, it means no more menstruation for at least 12 months, and then continuously.
Usually
Now,
doesn't happen
if,
suddenly.
if there
It doesn't
would be
happen
bleeding after menopause,
Oh, yes.
you have to be
Careful.
because 1 out of 3 it's related with something serious. No?
Okay.
Tumor, cancer, hyperplasia.
Again, best to see your gynecologist.
Yes.
Dr.
Yeah.
Sikiang, how about hormone therapy and diet and lifestyle that one has to adapt when
Due
one
to
is
menopause.
undergoing? Yeah, due to
Well,
menopause.
exercise would help as usual. No, hormonal therapy is not very popular because women are really hesitant. When you say hormone, palang takot na sila, no. But to be honest, hormonal replacement therapy has a lot of advantages. The thing lang is we have to screen patients who are safe to have hormonal therapy. No? If you don't feel anything like you don't have hot flashes, some women don't. They just have menopause, then they suddenly
Just like other women don't have dysmenorrhea, di ba?
Yeah, so parang, I don't have my menstruation na, no? So, some women, they don't feel anything, so they don't really see a doctor, no? But I think more than the signs and symptoms of menopause, women are very, very conscious about how they will look when they go into menopause. So, wrinkles, dryness, painful sexual contact with the partner, and incontinence. So all of this, we have a lot of products now, no, that can help with the dryness. Okay, so that just see your doctor kasi sometimes it will cause friction sa mag-asawa, no, because the women are, you know, irritable.
Yeah, and they don't understand. The men sometimes don't really
and
understand.
guys are you know, so
They
we
take
just
it personally.
Yes, so they take it personally, but actually the wife is going through a lot of changes.
Okay. Whether it be dysmenorrhea or menopause, we always must see our
Yeah, but what
healthcare
attracts
practitioner.
women mostly is when you tell them the truth that if you use hormone replacements after menopause, the aging process is very much slowed down.
Yes.
So if you can hear the report of patients, you know, and their hormone replacement therapy. Well, Dr. Iganila, we had a class reunion after 20 years.
She looked like the youngest in
You
the
know, I
reunion.
looked the youngest in the group, and I told them my secret. I was taking hormones, you know. Now, in the Philippines, people are scared because there is an attached risk of cancer, no? But in well-developed countries, in America, in Europe,
This is an alternative.
where 60 to 70% of menopause women are placed
Taking
on
hormone replacement.
hormone replacement therapy.
Okay, so there are alternatives, and there are, you know, for those who want to take hormonal replacements or hormone therapy, and for those who want it the more natural way
Yes.
by exercise and
Soy milk.
diet and so and soy
It
milk.
helps. Yeah.
That's
You know what?
why-
I can't cut this discussion, but I'm sorry, Doctor, we don't have a lot of time. We'd like to thank both of you for
Oh,
coming
thank
on the
you.
show, for helping us understand, you know, all these uterine conditions, and helping them, probably the men also out there, help understand their wives or their
Yes.
girlfriends or their moms even.
Yes.
So we'd like to thank our guests for helping us understand a very vital part of womanhood, which is her menstrual period. Thank you so much to Dr. Santiago del Rosario and Dr. May Sikiam. Next Tuesday, we will talk about cancers most common to women. See you again next Tuesday on MedTalk, 10 p.m. on your scheduled on-air health consultation here on the Solar News Channel. This is Angel Jacob. Thank you and good night.